Lori again, and today I'm going to be doing a basic IV insertion. With this in mind, I have to check the doctor's orders, the type and dilution that I'll be using for the IV, and also check the history of allergies and any laboratory data that I should be looking out for. So I'm going to be introducing myself to the patient, knock on the door, hand sanitizer. Hello, how are you doing today?
Hi, how you doing? Thank you.
All right, great. I'm Megan. I'm going to be your nurse today. Can you tell me your name and date of birth?
Arm Handy, 0623. I'm sorry, June 23rd, 1987.
Okay. I'm also going to check the armband that he's obviously not wearing, but he is. And we'll check out this is the right patient. Okay. Well, Mr. Handy, I'm going to be doing a IV insertion. Have you ever had one before?
Yes.
You have, so you're like a pro at this?
Mm-hmm.
Okay, great. All right. So let's get started.
All right.
All right, so I'm basically going to be taking a Christmas tree needle. Oops. Christmas tree needle. I'm going to be opening an alcohol prep pad and cleaning the solution or saline bottle. I'm going to be drawing up 3 milliliters. No bubbles. Awesome. And I'm going to be attaching it to a needleless device, aka the alligator clamp. Sharps container. And I'm going to be priming the INT extension tubing. So I'm going to be opening up the package. I'm also going to take a alcohol prep pad and clean the top of it just because I'm so used to it. I'm going to unclamp it. And inject that. And we'll let that rest right there. And I'm going to clamp it back up. All right. All right, Mr. Handy, I'm going to find a vein now. Can you tell me which is your dominant arm?
My right hand.
Right hand. Okay. All right, so I'm going to try to focus on the left arm, but I will also ask the patient if he or she mostly, but if they have had any mastectomies, shunts, fistulas done, I'm going to ask that the patient open and close their hand when I find a vein. I'm also going to not choose a site that hurts to touch. I'm not going to choose a hard cord-like vein. I'm also going to pick a site most distal to the arm. So, okay. All right, so I'm going to find a nice, juicy, bouncy vein right here. That's a good one. All right, that doesn't hurt, does it?
No.
Okay. All right. So I'm going to apply the tourniquet about 4 to 6 inches above the site that I want to do. And a bunny loop, tight bunny loop. I'm going to check the pulse of the site that I want to do it in. That's a nice pulse. It's a good pulse. All right, I'm going to apply my gloves. That didn't happen. And then I'm going to take an alcohol prep pad and cleanse the site in a circular motion. Okay, I'm going to let that air dry. All right, and because the doctor ordered a 20 gauge, I'm going to be doing a 20 gauge for medication administration. All right, so once this is dried, I am going to warn the patient of a quick prick. That's what I'm going to be doing. So I'm going to pull the skin taut the opposite way. And are you ready, Mr. Handy?
Yep.
All right, I'm going to insert it with the 15 degrees bevel up. Insert that right. 1, 2, 3.
No.
And assess for a blood return. Just looking good. Pretty good. All right, and then I'm going to advance it in another 1/8 inch and 1/4 inch. I'm just going to advance the hub in and remove the stylet. And hold that. Sharps container, where that goes. Going to release the tourniquet. Unclamp this and hook it on. All right, and I'm basically going to aspirate for blood return. Looks good. And I'm going to instill the saline using a push-stop method. And then I'm going to reclamp that. Take the hub off, or the needle off. Just going to throw that in the sharps container, because why not? Alright, so now I'm going to be taking the Tegaderm and putting it directly over the IV site, showing where the site is and the hub. And then once I do that, I'm going to initial it, put the date and the time on there and the type of gauge used. Alright, and then I'm also going to be taking some tape and taping this up the arm like this. Just tape that down so it has a less risk of being pulled out. Alright, Mr. Handy, that wasn't bad, was it?
Nope.
I'm going to be, like I've already said, but I'm going to be throwing all my sharps container in the sharps box. That's already been done. Alright, Mr. Handy, well, that was great. You were such a champ, and I will be back later to give you your medication, okay?
Okay.
Do you need anything right now?
No, ma'am.
Alright, well, you know where the call bell is. Just give us a holler if you need something, okay?
Alrighty.
Okay. At this point in time, I'll be leaving the room, throwing my gloves away, and all that fun stuff, hand sanitizing, leaving. And at this point, I'm going to be on my Mars system, and I'm going to document the date and time, the insertion site, which is the left forearm, the left forearm, and then the size and type of the catheter used, the number of attempts, and how the patient tolerated it, and if I gave any instructions regarding the IV insertion, I would document that as well.